Hello, and welcome to the Tactical Project. I'm your host, as always, Tactical, working every day to bring you the best guns, gear, and knife channel available on YouTube. And today's video is sort of a video response to a recent video by Nut and Fancy. If you guys aren't subbed to his channel, go ahead and sub. I really enjoy his channel. Most of his videos I really get a kick out of. He's a great guy. Go sub there. But he recently posted a video that said I would be dead in WROL. So WROL is without rule of law. And he basically talks about a recent experience he had with an infection and how, without modern medicine, he might have lost his leg at the very least, or at worst, he might have died. And the more I thought about it, the more I'm like, yeah, there's not really too much out here on what to do for this stuff. So, and then I looked down, and if you notice on my hand, I have a small cut. And I was like, it's not a bad cut. I cut it off of a piece of plastic off of a car. I got a little fender bender. Don't worry, nobody got hurt. But whenever I was cutting a piece off of the car so that I could drive home, I cut my hand, and as you can see, it's a little red, but nothing bad. But I live in Pennsylvania where it gets really humid over the summer, and it would take pretty much a day in humid weather for this thing to get infected, and now all of a sudden you're talking about a bad situation. I should have been wearing gloves whenever I did this, and I didn't. But even something as innocuous as this can be life-threatening in a WROL situation where you might not have availability to modern medicine if you don't know what to do. And that's what we're going to talk about today, is what to do, how to build a medical kit, because I told you guys I would do that, some books that I could suggest for you to start getting into that, so that you can learn about how to treat injuries and wounds and different things on plants for like herbal remedies and stuff like that. So this is going to be a long, I'm going to call it feature-length video. So I don't know how many of these I'll get into. If I get a good response out of this video, though, maybe I'll do more like this. I don't know, just trying to, sorry about the talking hands. I got a lot of up-close stuff to show you guys. So, alright, so let me talk about some other stuff, too. So, my background first, so that you know where I'm coming from. My profession is, I'm an athletic trainer. So, if you guys don't know what that is, the Super Bowl just happened, and you saw every time one of the Seahawks players got hurt, the guy that ran out there to take care of the injured athlete wasn't a doctor. He was an athletic trainer. And an athletic trainer is sort of like a, if I had to describe it, it'd be a nurse, a physical therapist, and an EMT rolled into one. So I guess the closest other profession I could think of for it would maybe be something like a Navy corpsman. I feel like that's probably the level of medical training that there's involved with this. It's immediate care and response. It can be for traumatic injuries too, like compound fractures, javelin. Like we cover all kinds of stuff on how to take care of athletes, but it can be carried over. We talk about, well, what happens if somebody gets hit with a javelin at track? How do you treat that injury? What do you do for it to keep them alive? To treat it if help was pretty far away. Javelin injury is pretty much like shrapnel injury or a projectile injury. So it carries over pretty good. So just to let you guys know about that, where I'm coming from on this. Do I know everything? No. I'd be stupid to tell you guys I know everything. So go ahead and talk to somebody maybe with a little bit more knowledge than me about this stuff if you have any questions. But just to let you guys know where I'm coming from on this, I do have some training. And that's about it. So first thing you need to know is, I said we were going to talk about kits. So the first thing you need to know is your skill level. Because you can have all the stuff in the world to perform something as complex as a heart surgery, but if you don't know what you're doing, why do you have it? You know, all you did was you spent money on stuff you didn't need and you're not going to know how to use. And it's going to be frustrating to know that you have stuff to do that, but lack the knowledge to use it. So, know your skill, and also know what you're building your kit for. You know, like I have this little kit here. This goes in my EDC. It's just got some gauze pads, a couple Band-Aids, some like generic Tylenol and aspirin. Okay, so this is for my EDC. This is just for like little cuts, something like that. Okay, so that's what this kit's built for. Now this kit is more, this is in my get home bag, and this is for more intense injuries here. So I have stuff like, let's look here. These are technically called nasal tampons. They're balled up gauze that they're intended to be stuck up your nose if you get a bloody nose. But you can also pack these inside of a puncture wound to stop the bleeding. So that's why these are in here. These are septic ampules. It basically chemically coagulates the blood so that you get a scab basically right away. These are really handy. They're worth their weight in gold. Contact lenses. I don't use them. My wife does. I have above average eyes, so luckily I don't need any of that stuff. Gauze pads rolled up. These are non-sterile gauze, and we'll talk about why you would have something like this here in a minute. These are just inside of a plastic bag. Quick Clot. I have 2 of these. These things are also worth their weight in gold. These guys are great. I guess with the original ones, they were having trouble with people getting chemical burns with them, but they hammered that out. I guess they reformulated. But even at that, even if you have the old ones, I'd rather have a chemical burn than bleed to death. So these are that, and this isn't even like what I would call my main trauma kit. This is just for get home situation. You know, you could get really bad hurt. That's why stuff like this is in here. But let's see here. Triple antibiotic ointment. Tampon. Now you guys are gonna laugh. You're like, you're a dude, or at least you sound like a dude. So why do you have a tampon? Same reason I have the nasal tampons. Alright. These things absorb blood like nobody's business. Anybody that's a real medical person knows that these things are worth their weight in gold also. Shove them into a wound to stop the bleeding. These things have 1,000,001 uses. These are just really great. Let me see, what else do I have here? I have, okay. These are cotton tip applicators. Alright. And tongue depressors. Because what you want to use the cotton tip applicators for is to clean out a wound, and also to apply like triple antibiotic ointment so that you don't contaminate your ointment. Because that's something that can happen too. Like if you ran your finger all through some blood and then you ran it over the tip of your tube here, you could contaminate all your triple antibiotic. Tongue depressors, they make good finger splints. They got a few different uses too. So that's why those are in here. Then we have povidone or betadine wipes here. These are good topical antibiotic also for cleaning. So something like this, you just tear it open, rub it on there real good. I typically tell people to scrub till your wound starts to bleed again, if it's getting a little funkified, because that'll self-cleanse from the inside out. So you scrub it, you get the povidone good and in there, and then you have the bleeding to push it out. You're not going to bleed a lot, it's just going to be a little bit. And then then you know your wound's clean. Also some alcohol pads in there. Couple Band-Aids, assorted sizes. I'm going to talk about this here in a second too. You don't need these, don't stress out.
sting relief. These work for like stinging nettles or insect bites. Good set of tweezers, nail clippers. Good set of rescue shears. These are mainly for cutting clothes and stuff. I have a really good pair of shears for other stuff. These are just for like cutting off clothes and stuff like that. Couple scalpels. I know a lot of people like to think that their knives are razor sharp. You can get your knives razor sharp, but I would rather have something that's intended for surgery. So that's why I have these in here. I have two. These are disposable ones. I'm going to go ahead and buy like a reusable one with a steel handle and you can replace the blades, but this is what I have for now. Then I have assorted gauzes. These are sterile gauze. They're in here. And what else we got? And these are non-stick pads. If you watch Nutton's video, they are Telfa is the name brand. Telfa. And basically what they are is they're a gauze pad with a coating on them so that when blood or something sticky gets on them, they don't stick, and then when you take it off, it pulls the scab off or gets stuck on there and it hurts really bad to take it off. So you need these. Alright, so let's go ahead and set this stuff off to the side. You've seen two kits now and saw what they were intended for. You see, this is a much more comprehensive kit for my get home bag than my EDC, right? Because this is stuff I might use every day. Most of the stuff in here, hopefully I don't have to use it hardly ever. Alright, now, concerning the, like I said, the Band-Aids. Okay. Band-Aids. A lot of people stress out about having Band-Aids, and I don't know why. Okay, so let's go ahead and take one out, and I'll show you why it's silly to get stressed out about, do I have enough Band-Aids? Alright. Let's go ahead and take this guy out. I guess we'll sacrifice one for the cause here. By the way, if you are buying Band-Aids, these coverlets are my personal favorite. I like these better than Band-Aid brand. These are really good. Okay. So you look at a Band-Aid and what is it? Well, it's got a sticky adhesive side and what looks to be a piece of non-stick gauze. Okay. So what we can do, let's ball that up now that we're done with that, is you just take either one of your regular gauzes or one of these non-stick guys, cut them down, okay, and then put a piece of Gorilla Tape on the back side, and there you made your own Band-Aid. And the nice thing about that is, if you see how big this is, that's a very large Band-Aid that you can make. Or you can open it up, cut a corner off, and make a bunch of Band-Aids out of it. Okay, so you can get, these are very modular. So, you know, whereas I might have to use like 2 or 3 of these regular size ones, or dig through for the right size Band-Aid, I can customize this to any shape or size that I need, and it will cover that up. And I just need the Gorilla Tape or electrical tape, which also has other purposes. And then there you go, I've covered, you know, these can be used for more than one thing, my tape can be used for more than one thing, and I didn't have to worry about, you know, did I have the right size of Band-Aids, did I have enough Band-Aids. This is all you need. A Band-Aid's just a non-stick gauze pad or a Telfa pad, or, you know, I'd be comfortable using even this non-sterile gauze for it. But that's all Band-Aid is, so no need to get stressed out, do I have Band-Aids. Just make sure you have gauze, because you're going to need gauze for a trauma anyway, so you should have a bunch of them. So if you have, you know, a few gauze and you're like, okay, well, I can just make a Band-Aid, then that's one less thing you have to buy, because pre-made Band-Aids are pretty expensive. So We went over knowing your skill. We went over what to put in the kit. Went over my opinion on Band-Aids. So let's go ahead and talk about, okay, you have all this stuff. Now, how do I know, how do I learn what to do with it? Well, my first thing would be go take a class. There's community colleges all over the place. Spend, a couple $100 on a emergency medical care or emergency response class. Do that, even if you're planning on like, well, I don't care about the tests, I just want to, take the class so that I've been exposed to it. That's fine as long as you're not trying to get a degree. Just go and take a couple classes about it. There's all kinds of places you can go that aren't a college where they offer classes in emergency response and emergency care. So that would be my first thing, would be to go to an actual class or clinic or something and learn about that. The next best thing would be to go buy a book. Now, this was another thing in Nutton's video where he was, struggling to try to find books for people to buy in a medical library. So I'll tell you what I would have people buy and what I have in my own personal library, medical library. The first thing you want to do is buy the field manuals that either the Army medics or the Navy corpsmen use when they're downfield. Those are really good books. I don't have one on hand here. I probably should buy one. I feel like what I learn and have up in the old noodle is enough, but I probably should buy one just in case I forget something. So that's the first book you should buy. The next book you should buy is, okay, they're using terms in that book that you might understand or not understand. So what I would suggest is a good medical dictionary. This one's Tabor's. I think this is their 19th edition. Medical stuff, the terminology doesn't change too often, so I don't think it really is going to matter which edition you get. This is just the one I have. This one's probably like 6 years old or so. But these are really good books, has definitions, everything. Just really good book. So need an encyclopedia in case you don't understand a medical term that they're talking about, because you need to understand what's in the book. Alright, the next thing you're going to need to know about is anatomy. So probably the best anatomy book out there, or the one that all others are measured by, are Gray's Anatomy. The first Gray's Anatomy is from the, I believe the 17 or 1800s. He basically grave robbed and then did illustrations in one. So Gray's Anatomy are the anatomy books that everybody else is compared to here. So here's a little bit of brain anatomy. There's like muscular skeletal anatomy here. And then there's some pictures of actual stuff. Very good definitions. The written well, good illustrations. Just really helpful overall. So Gray's Anatomy for your anatomy book. Any edition will do. This one's 39th edition. Again, this one's like 6 or 7 years old. Alright. So the next thing you're going to need is a way to diagnose injuries. This is a general medical condition in athletes. I like this one. And then this stuff, I'll write down like the author and whatnot so that you can maybe look this stuff up on your own, pick up a copy on Amazon. Alright, but these ones, they'll describe the condition, signs and symptoms, and what to do for it, what the common procedure is to fix it. Okay, so these are really good. This one doesn't have a whole lot. Like I said, this one's just for in athletes. They make other ones for all kinds of other stuff. So these are a really good book for general medical conditions. See, this person here got cut on their eye. Talks about how to treat it. Different stuff like that. So there's that. Alright, next thing you're going to need to do is, Nutton talked about storing antibiotics, and I'll talk to you about my opinion of that stuff here in a second. But let's say you do have a bunch of medicine you were able to procure, and now all of a sudden, since you're not a doctor, and even most doctors don't know off the top of their head what the appropriate dosages of stuff, you know, they might know of a few basic things that they prescribe all the time, but they're not going to know everything. So you don't know what the normal dosage is, you don't know what the lethal dosage is, you don't know what it interacts with badly. You know, you might be taking a medicine that becomes lethal whenever you take it with aspirin. Well, you don't know that, and you're taking this medicine, and then all of a sudden you get a headache, and you think, okay, well, I'll just take an aspirin, and you kill yourself accidentally. So, in the end, people didn't kill you, natural disaster didn't kill you, and without rule of law, you killed you because you lacked knowledge. I'm not going to let that happen to you. So what you're going to do is, this is a sports medicine edition, but Therapeutic Medications manual. Okay. And what you're going to do is, alright, albuterol. Okay, here's one. Okay, albuterol. It talks about the name of it. Okay, and it gives the generic name, side effects. Okay, so side effects for albuterol: nervousness, bronchospasms, which are in your lungs, headaches, bronchocysts, restlessness, dizziness, sleepiness, dry mouth, appetite changes. Okay, so those are the side effects that are possible for that medicine. And albuterol, that's used for, I can't even think anymore. It's for, like asthma and stuff like that. Alright, so warnings. Wait 3 to 5 minutes for second inhalation if more than one inhalation is necessary per dose. Okay, so you're supposed to wait when you do that. Now, if you didn't know that, maybe it could become potentially dangerous. Dosing. Shake aerosol canister before using. Okay, so that one was pretty straightforward. There's all kinds of stuff in here. All kinds of medicines. They're just listed. And what you would use them for. Hold on, let's go back to albuterol here. I missed some stuff. Okay, so bronchodilators, symptomatics. Alright, so actions. So what's the medicine do? Indications. Okay, so what you would use it for. Used to treat reversible bronchospasms associated with asthma, bronchitis, emphysema, exercise-induced bronchospasms, and other obstructive diseases of the lung. Okay, and then this one, since it's a sports version, it has banned substances. NCAA or USOC may list some of the substances as banned for athletic use because they consider them athletic enhancers. So, talks about this stuff. Let me see here. Let's see a good one here. Erythromycin. Let's look that one up. Let's look up any antibiotic. Alright. Let's see here. Antibiotics probably under A. Analgesics. Narcotic analgesics. Okay, here's one. Codeine. Okay, I know we said we were looking for antibiotics, but let's just look at codeine. Okay, Tylenol with codeine, tablet, elixir, Fanafan with codeine capsules. So these are the different generic and brand names. Side effects: drowsiness, dizziness, blurred vision, nausea, vomiting, constipation, sweating. Avoid alcohol and other drowsiness causing drugs that can intensify overall sedation. Take with food. Indications that you would use, what it does. Okay, so these are really good books so that you know how the drugs are going to interact, possible side effects so that you know what to expect if you are taking it, how to dose for it. So these are inexpendable. So go ahead and pick one up. Even if it's not this particular one, it would be any therapeutic medications book. So there's this. Now I'm going to go ahead and talk to you guys about antibiotics and stuff like that, how to acquire them, and if it's a good idea. Okay, sometimes those therapeutic medication books, like I showed you, this particular one doesn't because it's not a concern. There are medication books out there, though, that will tell you what the half-life and efficacy is of whatever that particular medication is. Alright? So if you get one of those, you know how long your medicine's going to last. Or how long it's going to be good for, anyway. So, let's say you're a good boy or girl, and you take all your antibiotic like you're supposed to. So that makes it kind of hard to store up, right? You know, if you use it all, you don't have any left. So what do? Well, over the internet, you can order veterinary supplies. Now, most of this stuff is safe for humans, like the antibiotics and stuff. But you might have to do it. Like, they might send you a literal horse-sized antibiotic pill that you have to cut down an eighth so that it's safe for a safe dosage for people. But it's chemically sound enough so that it can be taken by people. Now, I know that I said that, but I'm not advocating doing that just for legal reasons. I can't say, hey, go do this. But I'm saying that you could. You could do that. You can get lots of things for veterinary supplies that are perfectly good, or I don't see a reason why they wouldn't be good for people. I'm not advocating it. I'm just saying that it could be done. So that's how I feel about that. Between that and your therapeutic medications books, you should be good on knowing how much to dose and how long your stuff's going to be good. So nothing. If somebody forwarded this video along to you, that's how you're going to know. Alright, next thing you're going to know is, okay, you do have your medical supply, but let's say we're 4 or 5 years without rule of law. Hopefully that didn't happen, but let's just say worst case scenario, Murphy got us. We haven't had access to modern medicine in quite some time. Any modern medicine we did have, we already used. Okay? So what do you do now? Well, or, you know, you didn't have the stuff to begin with. Well, what that leaves you with is herbal plant remedies. Now, most of these are very good. Not quite as effective as modern Western medicine, but very good and will get you through in a pinch, especially if you don't have any other access. So the first thing I'm going to talk about is a great antibiotic, honey. Not this guy, not the bear stuff. You don't want this. This is crappy for that. This stuff's been processed so much it can barely even be called honey anymore. I'm talking about the natural stuff. You know, find a local beekeeper that doesn't treat as honey. Just basically get it put in a canning jar, and that's it. That stuff makes a great topical antibiotic. You just rub it on and in your wound, and that's basically all you do with it. And then you dress the wound. Make sure to clean it out every so often because the sugar can, after like half a day or so, can actually have the wrong effect that you're looking for. So you want to clean it out pretty often, but it does have a antibiotic effect to it, and it's very good for you. It's also, if you have allergies and you get honey from a local bee person, the pollen that they use will actually use to, if you eat the honey, will actually help reduce your allergies. So something to think about for those of us like me that have seasonal allergies because of pollen levels. If you get a local beekeeper to give you some honey, go ahead and eat it. Good to go. It should help treat or, lessen your symptoms. Okay, so now that we got through honey, because that's not in the book I'm about to show you, just giving you an idea. All right, is in my opinion, the most useful plant on the face of the earth. Plantain. Okay, specifically, Plantago Major. And we'll talk about what book this is, because this is an awesome book that if you buy no other book that I showed you today, go buy this book. Okay, the illustrations on this are perfect. It shows you exactly what the plants look like. Okay, and it tells you what the plants can be used for. So let's go ahead. I'll just read you a little excerpt from this book about what Plantago Major is used for. First of all, if you can see from the illustrations here, this is what it looks like when it's young. It's also, I've heard people call it pig ear, because it's sort of shaped like a pig ear. Broad, kind of spear-pointed leaf. So, that's what that looks like. Alright, and I know for a fact that this plant's great. Let me go ahead and tell you guys a story before we get into this of my first experience with plantain. I was about 13, 14, and I got poison ivy really bad one time. I'd never had poison ivy in my life, got it, and man, did I get it bad. So, and I was out at a my parents' own property somewhere where there isn't really anybody around. So there was this old backwoods guy that said, he walked up to me, he said, "Son, does that hurt pretty bad?" And I said, "Yeah." He said, "Well, I think you've had it about long enough." So he took me out in the yard. He got Plantago Major, one leaf of that, one leaf of dandelion, and another one of orchard grass. Balled it all up till the juices were coming out. Rubbed it on where I had my poison ivy. Next day, the poison ivy was almost gone. 3 days later, poison ivy all gone. Didn't have to go get any type of antihistamine. It should have scarred, no scarring. This is really, Indians referred to this as like a miracle drug. And I mean Native American Indians. Don't get all politically correct on here and say, Indians aren't from America, Indians are from India. You know what I mean, Native Americans. Okay, so it says, plantain provides beta-carotene and calcium. All species contain mucilage, a carbohydrate fiber. This fiber reduces both low-density lipoproteins, cholesterol, and triglycerides, helping to prevent heart disease. So it already prevents heart disease. A lot of people will dry it out and grind it down and make a tea out of it, and that's how they try to get the heart disease fighting effects. Plantain also contains monoterpene alkaloids, glycides, sugars, tripans, fixed oil, linoleic acid, and tannins. Man, that was hard to get through. Plantain is astringent and soothing, so it takes oils out. Also containing a cooling effect. So it's a topical analgesic. An analgesic is something that lessens pain. So it's a topical analgesic. A lot of people, like I said in my story, if you rub it till the juices come out, it'll do that. And then you rub it on whatever's hurting, like your open cut or whatever. It'll reduce some of your pain. Alright, let's see here. Cooling effect, it works internally and externally, soothing, rebuilding, and helping to waylay and prevent infections. So it's also an antibiotic. It helps prevent and fight infection. So if you got into without rule of law situation, you needed an antibiotic, didn't have any access to any honey, Plantago Major is your man. An infusion of leaves or mashed seeds treats sore throats, gastritis, diarrhea, bronchitis, fever, inflammation, kidney and gallbladder disorders, and cysts. Chinese herbalists use it for hepatitis. The infusion is also a good douche for yeast infections, and the fresh juice is an effective diuretic. Okay, so, sorry, I'm over here. I didn't move it over for you guys. Plantain's astringent qualities make it a scientifically verified remedy for insect bites and skin irritations. Shred the leaf with your fingernail until it releases juices. Repeatedly rub it on the trouble spot. Relief comes within 15 minutes. If you've touched poison ivy, this will probably prevent a rash. So this is what I think, whenever I did get poison ivy, I think this plant had more to do with it than anything else. But I have gotten poison ivy since then, rubbed all 3 leaves together, and went right away. Next time, if I ever get poison ivy again, I think I'm going to experiment a little on myself and try just the plantain leaf to see how that works out. Let's see, prevent rash. You can also make an ointment or salve from this herb. Plantain seeds, mucilage fiber, like-related psyllium seeds is wonderful for cleansing and soothing the intestine. It acts as a gentle laxative. A European species is the main ingredient of the laxative Metamucil. Okay. The bulk fiber also helps control appetite and reduces intestinal absorption for fat and bile. Plantain also makes a great breath freshener. Let's go up here. Probably because of its chlorophytic content. Next time your date reaches for a search, grab plantain. Okay, so that's basically all this. It also talks about how you can use it to make a salad. Stuff like that. Really, if you only learn one plant, this is the plant you need to know. It fixes everything. It's a pure miracle thing. If you know what this is, you basically never have to go to the doctor again. So there's that. There's all kinds of stuff online too on like how to make the salve and stuff. It's pretty easy to make a salve once you know how to make one. They're pretty easy. So it's got all kinds of plants in here, and for different times of the year too. So if you get stuck out in the middle of winter, it'll still tell you how. So there's let's go ahead and look at table of contents. Introduction to foliage, identifying wild plants, life cycles, plant types, natural habitats, edible wild plants of mid-spring. Let's see here. Edible wild plants of summer. Like I said, it does it for all the times of the year. Then it has. Let's see here. What am I looking for here? Cooking with edible wild plants. Wild food recipes. And then it's got all kinds of different stuff for that. So, if you guys are ever looking on what stuff's safe to eat and how to make stuff for it, there's that. And that's basically it. So this is a fantastic book if you ever get a chance to get it. It's identifying and harvesting edible and medicinal plants in wild and not so wild places, because it also talks about stuff you can just get in your lawn. Like that Plantago major in your lawn. That's why I will never ever weed treat my lawn, because it's considered a weed. How could something that helpful be considered a weed? So, like I said, identifying and harvesting edible and medicinal plants in wild and not so wild places. The essential guide to finding and using delicious wild edible plants for nutrition and better health. It's Wildman, Steve Brill, with Evelyn Dean, illustrated by Evelyn Dean, with more than 260 superb illustrations. You saw the illustrations are great. This is just a fantastic book. Pick it up online. So, some other stuff that I'm going to talk about just to sort of wrap this up that's maybe not in here. Let's say, I don't know, is it in here? I don't know. I don't think they put it in here. Okay. First of all, let me say that I don't advocate drug use. Okay, it's not my thing. Don't do it if you don't have to. But I will say that peyote and marijuana are both good for killing pain in a without rule of law situation. So let's say you get really messed up, you're really hurting bad, you need something to reduce the pain so that you can lay there and heal and relax. Peyote is a good one for that, as is marijuana. Like I said, not advocating drug use. Don't mistake me for that. but they are both very good at what they do at relaxing and numbing the pain. Okay, so take that for what it's worth. Now, also in Nutton's video, he talked about basically having a positive attitude and how that heals you. And that is something you learn about in medical psychology, is how if you imagine, like let's say this cut on my hand, okay, and you're laying there and you're visualizing and you're saying, okay, I'm seeing my white blood cells attacking the infection, I'm seeing my skin healing, I'm seeing, you know, my hand healing, okay, and you just keep thinking that over and over and over again, and it's sort of like telling your body what to do. And it does. There are studies out there that show that has a positive effect on outcome. So you just imagine your hand getting better. You imagine, you know, your antibodies attacking this infection and fighting it off. You imagine your skin healing or whatever it is that's healing, and you keep going from there. So that is a real thing. That's not just some sort of hokum, for lack of a better word. Okay, so that's a real thing. Alright, and I feel like this video has probably gone long enough. We talked about everything. Talked about the books to buy, talked about natural medicine versus Western medicine, and that's about it. Talked about all the books, talked about how to build a basic kit. And if you guys liked something particular about this video, felt like I didn't cover it enough, go ahead and leave a comment. And if there's a good enough response, I'll be more than happy to make all kinds of videos on this stuff. I feel like I have a lot of knowledge about this stuff, and I'm more than happy to share. You know, like I said, I don't know everything, but I like to think that I know enough to get by. So maybe somebody will like what I'm doing, and let me know, hey, I'd like to know more about that. I might do another video on like how to treat a wound or how to do stitches and stuff like that. I don't know. If you guys are interested in that stuff, let me know. Well, I'll be more than happy to do videos on that stuff. But that's all I have for you guys today. Please make sure to like, comment, and subscribe so that you can be one of the first to view my videos as they become available. Till next time, tack out.